My name is Willem Vallée, and as a former open heart surgery patient, I know how involved the surgery can be. A few months ago, we started being very worried about my mother-in-law's health, as she was getting conflicting advice regarding her heart condition from a number of surgeons and specialists in the Nasik area. We reside in Singapore, and there we did internet research about leading hospitals and leading heart surgeons in the Mumbai area. And we were fortunate to find very good references for Dr. Kumar and also for Lilavati Hospital. We came out to India, insisted that our mother-in-law come to the hospital, meet with the doctor, where we very quickly discovered that she was in urgent need of surgery because of a very large hole in her heart.
And we made an appointment. I am Shobha's daughter, Seema, with Dr. Pawan Kumar, and doctor and his whole team at Lilavati were very impressive and very fast in responding to get an appointment for my mother, and she agreed to go for an angio. Dr. Pawan Kumar was very careful regarding that she's also a kidney and a diabetic patient, to first monitor her situation, monitor her CBC count, and that we do not hamper her kidneys. So we got admitted 2 days prior to angio, and Dr. Pawan Kumar monitored himself all the signs and symptoms with the other umbrella team who were gathered around her. The angio was successful, and we realized that there were no blockages, and ahead Dr. Pawan Kumar was very, very helpful in convincing my mother that she has a hole that was 19 mm, which is size of a huge coat button hole.
And my wife Shobha Salve, yes. And I found Dr. Pawan Kumar is very jovial person. And for patient, he says he's my friend. And I really appreciate what he was communicate with the patient. It was like a friendship, like a old, they got some relation and attachment. He never think this is my patient, and he loves patient's ministry.
Here is a patient, Mrs. Shobha Salve. She is 62 years old, and she had in fact hole in the heart. Hole which we call is atrial septal defect. It's a congenital defect. By birth she had a hole. Normally we operate these patients in the early decades, 10 years or 20 years, maximum 20 years or so. But it was not diagnosed, and the natural history of this disease is that they become complicated, or complications manifest beyond the age of 40 years. And so same thing happened. In fact, she is 62 years old. The first question was that in her mind that why should I get operated at age of 62 years? Similarly, her family also was very much not convinced to make her operated by surgery. So it's a difficult decision to make at such age. But as per our natural history and progress of the disease is concerned, our research says that beyond certain age they get into complications, that they may not be operable, or they get into rhythm problems. And then if there is any surgery required in their body, first thing is the clearance from the heart point of view, for anesthesia. So these are the certain things which are that make these patients mandatory to undergo surgery. She was also very reluctant to undergo surgery, and but with the full support of the family and the daughter and the son-in-law and the husband, she ultimately got convinced that surgery should be the choice of treatment. And she underwent atrial septal defect surgery, and she has recovered very well, with the kidney well protected. Serum creatinine remains same, it went up but it has come down now normally, and she is recovered very well. So my message is that even if there is a find a ASD or hole in the heart with the age beyond 50s, they should be given an option for surgical closure. Other point of view is that why not do a medical management, or why not do a umbrella device closure? Medical management will not benefit her, will not protect her for her heart, for any other further surgery or any other failure which can happen in future. And at the same time, the device closure will require a lot of intervention which may affect kidney. So surgery is the safest option when there is a comorbidity of moderate kidney insufficiency and other diseases. That is why we chose this option, and she underwent successful surgery at Leelavati Hospital. I am so happy to see her and recovering so fast and going home in next few days' time. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
आभार मानता हूँ
Thank you.
तुमचे सगळ्यांचे.
धन्यवाद पवन कुमार डॉक्टर.